I'm Bill Davenhall, and I'm the Senior Health Advisor for Esri, a U.S.-based global corporation. It's really about geography, and geography is a framework in which we put a lot of our data. So when I say know your places, how much do you know about the exact neighborhood in which you live, or the region in which you live, or the country in which you live? And it has to do with accumulation of a lot of variety of different information that's health related, or as I like to call it, relevant to health and wellness, that could impact your health or make you healthier or make you sick. I like to focus on the health part as opposed to the sickness part. Well, geographic information is that framework. So what we're really doing is we're saying we live out our lives in specific geographies. You know, most people know their postal code, they know the county, they know the state they live in. So most of the data that gets collected and is used in decision making and policy making is put into those buckets. So basically we understand our world by these artificial definitions of boundaries. And it's within those boundaries we put all this meaningful health data. So when I say the geography, it's not as if the geography itself produces either wellness or illness, although that is a possibility. I mean, there are places in the world where the natural environment is either toxic or more friendly to human inhabitants, and that's when geography does play a more serious role. But the kind of geography I'm talking about is a more synthetic geography. And if that geography changes, then the underlying data needs to change with it. In most cases, governmental agencies started to collect data prompted by the need to understand what diseases were affecting the population. And they started to put this data into these, what I call geo-administrative buckets. And that's how we essentially got this large accumulation of data that the government uses to make policy decisions. They aggregate it so they maintain confidentiality. And it's generally useful to a wide variety of people, but it's not specific. So you'll see warnings on a lot of the public health data and a lot of the public health data websites that say, don't use this information for making decisions about your own health. Which of course I would have to tell you I disagree with. I think, well, what's the purpose of collecting it? There is a purpose if you want to know, we want to improve the general health of the population of a country like the UK. But most of us want this kind of detailed information. I mean, we look at our rooftop now on Google, and I would say we know where we live, so why are we looking at our rooftop? And it's part of the curiosity of humans. So we want to know what's around us. We want to know what people are dying from around us. So while it's good to know, I guess in general ways, what the health of a population is, what you're interested in personally is, well, what's it going to be for me? The key there is knowing it. So a lot of this information, you have to know what you're looking for to find it. So that may be just a change in the way governments market this information to the public. And maybe they're going to have to buy billboard time and TV time to educate the public as to, you know, go to this website if you want to check out the 15 new maps we've just put up from our agency. But generally, I would say people need applications that are kind of specific to where they are. They need what's around me. They need that little, hit that little button that says I'm here, and then the data flows in and tells them what's around them. So I think that's a change in style of how the information is delivered. It's not necessarily a fault of government. It's something that government is going to have to move into, in my opinion, across the world. I think they're beginning to realize it. And it comes about from what I would call informed patients. I consider myself one of these people that's probably, it would be interesting to know what a doctor puts in his notes about me. Is that I want a partnership with my physician, so I expect much of them and they can expect a lot from me, and I will offer information in spite of them not wanting to hear it. So part of it is that I think younger physicians are beginning to acknowledge the fact that they're going to have patients that bring information to them, and they need a different kind of protocol and sort of ethic to deal with the patient who comes well informed and is in the process educating them. Well, we don't really produce any really specific health information. We provide other people's data in a format that's more usable and maybe packaged differently. So in some parts of the world, Esri produces estimates of population, or it might be some census data in a country and so forth. In the UK, statistics that are organized by the Ordnance Survey and those kinds of things. But our technology actually allows that to be brought together and then put into context in a geographical area. So we don't actually put a seal of approval on the data. We tend to allow people to take their data and put it into a format that makes it easy for people to get to and share. The way I explain it is, it's like the difference between a field of blooming flowers that you went out and sowed wildly versus building a garden like at Versailles, where you actually gave some thought as to how this garden should look. And you picked the plants carefully, and then you carefully controlled the planting of them, and you had a sense of what you wanted people to feel like as they walked through your garden. So a lot of the data that's been generated out there in the health space has been blooming flowers. You heard, we've been talking about this morning about pilot projects and so forth. These are blooming flowers, and while they're pretty and they're beautiful, they haven't built a system. So what I think the whole health and human service field is going through is, how do we build systems that routinely provide us useful information from all this data that we have that serves patients and informs the caregivers that have to get involved in the therapeutic and healing process. So if you think about all that coming together, it is like connecting all the dots, but in an organized, systematic process. You can't rely on government's line item budgets from year to year if you're going to build a system. You have to commit yourself to say this is going to be a long-term effort to bring this data together, because we're going to be with these people for their lifetime. In the UK, they actually have some initiatives that talk about, they just published a new data vision of the National Health Service that I think is worthwhile read, and basically says we not only need to be concerned about health, we need to be concerned about our social services and how these connect to the needs of the people that are getting health services, that they're not disconnected items, they're together. So they're laying out a strategy of how they're going to bring all that data together. And that's not going to be an easy task, but I'm saying country after country, as they spend more money in the health and human service sector, they're going to have to get to these integrating technologies and what we call system interoperability processes real fast, because if they don't, they'll just be replicating systems, and they'll have multiple systems that don't talk to each other, and then we'll be back putting systems back together again.